Again, welcome to this week's office hours for ESG and ESG-CV. My name is Helena Emanalo, and I'm today's moderator. If you're just joining us, please go to the chat and introduce yourself with your name and region that you represent. As a reminder, the office hours session is being recorded for public record. Office hours recordings eventually will be available on the HCD ESG webpage under technical assistance and training. If you don't see them posted yet, just know that HCD is working on getting them uploaded to the website. A copy of the slide deck and recording will also be emailed to you by your grant administrator. Next slide, please. How to ask a question. All questions must be submitted in the chat box. Please type your organization and question into the chat box. The team will read questions out loud at the end of the presentation and will provide answers if possible throughout the presentation. Because today's topic has a lot of content, any questions related to this topic will be answered via email, and we'll send out the Q&A transcript. All questions and answers entered into the chat box will be recorded as part of the public record. Next slide, please. Today's office hours session agenda includes ESG and ESG-CV updates, office hours updates, ESG and ESG-CV Q&A, and a brown bag session for ESG new provider orientation. Next slide, please. And now I will hand it over to Connie for our ESG updates.
Thank you, Helena. Good morning, everybody. Again, just want to remind everybody we're still working on our 2021 ESG applications that came in under that NOFA. We're getting closer. I anticipate having award announcements for you by the end of this month. 2020 contracts, I wanted to just remind everybody that has a 2020 annual contract. We're seeing some overhead, some indirect costs on the detailed expense reports and for within the activity itself. So I just want to remind that if you're expensing for rapid rehousing, homelessness prevention, shelter, that we only want to see direct costs there. If you have when you applied for this contract, you ask for indirect costs, then that's fine. Just identify them. For example, we've seen, I had one grantee put under rapid rehousing expenses for the PG&E bill to run that for that rapid rehousing building and the overhead just for that rapid rehousing building. And the only way we could pay that under the component would be if they were indirect. Otherwise, they belong in grant administration activity. And a lot of folks I know do not or were not awarded for grant admin. So just want to keep that in mind. If you're not sure, please reach out to us and we'd be happy to meet with you and talk through that. Next slide, please. We've talked about in the past, just want to have this in the slides for a few more weeks about the monitoring, mini monitoring, as your reps reach out to you. With every RFF you send them, they're going to be asking you for some backup documents. And I know that it's great training and learning for all of us. This isn't formal. We're not going to give you corrective action letters or anything. It's just going to be a conversation if we find that maybe there's been an error as far as documentation and as that's being kept and so forth. And next slide. And again, just want to make sure everybody's, sees the names of those that are on our ESG team. Those are your reps. And that you can always reach us if you have any questions at esgnofa@hcd.ca.gov, and we'd be happy to work with you. And if you ever want to schedule a Teams meeting with us, those are great. It's nice to see faces, so don't ever be shy about asking for a Teams meeting. And that's all I have today.
Thank you so much, Connie. Next slide, please. Thank you. Now I just have a few ESG-CV updates and reminders. Grant administrators sent a request to all subrecipients on January 28th for the contact person, an email address of the person that will be responsible for uploading monitoring documents to HCD's monitoring site. If you did not provide this information to your grant administrator, please do so as soon as possible. All ESG-CV subrecipients that provided their contact information should have received an email from HCD with a link to access the monitoring site. Please contact your grant administrator if your contact person did not receive an email with the link to access the site. Next slide, please. Upcoming office hours topics will be February 9th, California HCD ESG-CV monitoring. February 16th, housing first principles. February 23rd will be trauma-informed practices, and March 2nd will be coordinated entry system assessing the assessment. Next slide, please. Please use the following links for COVID response resources, including CDC and NHCHC guidance. Next slide, please. In addition, for ESG resources, you may use any of the following links and technical assistance resources provided on this page. Next slide, please. And now we will move on to questions. If you have any questions, please feel free to type them in the chat. Keith asked, do we have any updates for ESG-CV written guidelines being provided? We are anticipating those in this month, later this month. Norma asked if Connie can repeat the guidelines regarding the indirect costs.
Connie, you're still muted, so you might have to unmute yourself to answer that question.
Can you hear me?
Yep.
Okay, couldn't find my mute and unmute. So it's, if you ask for indirect costs, all I was trying to get the point across is that if you're billing us for rapid rehousing, a homelessness prevention and street outreach and so forth, those need to be direct costs. Staff charges and other costs that are directly related to the program, not what the overhead is, what it takes to keep your building going. Those belong under grant admin, or you can call them indirect costs, and if you want to apply them as indirect costs, you just need to tell us that on the DIR. We're just seeing, again, I'm finding a lot of charges for costs that are not directly related to that, running that rapid rehousing, if that makes sense. And maybe Chris or Heather can jump in there if I'm not explaining myself well. So I should be seeing on rapid rehousing, case managers charges, rental assistance for your clients, housing navigator, staff charges. I should not be seeing the PG&E bill to pay the heat for that rapid rehousing building. That was some of the things I'm seeing. If you're calling that an indirect cost because you told us when you applied back in 2020 for this contract, hey, I want some indirect costs, I'm going to claim those. That's okay, but at least put it next to the charge. Otherwise, we don't know. Does that help? And as far as what qualifies for indirect costs and so forth, well, that is a very, that's something I couldn't go into detail with, but just be mindful of what you're putting when you're expensing those charges. They need to be direct costs for that activity.
Got it. Thank you.
Okay.
You can pause for a minute to see if anyone has further questions. Ben asked, if we did not request indirect at the time of application, is there an opportunity to amend and include indirect?
Yes, but we would need to redo your budget, because that, of course, as you know, Ben, takes away some of your ability for direct costs. That's going to reduce your funding. It wouldn't increase it. So if you want to do that, then let me know and we'll work with you on that.
Thank you, Connie. If you have any further questions, please contact us at or contact your ESG representative at esg@hcdca.gov. Now I'm going to hand it over to Karen for our ESG new provider brown bag presentation.
Actually, Helena, I'll be talking first. I'll hand it to Karen. Thanks, Helena. Thanks everyone for joining us. I think this is our 4th week doing brown bags after office hours. So these, for those who aren't aware, are relaxed settings for us to have conversations, to have a discussion. So it is my pleasure as the training and technical assistance lead for this project to have 2 of my training and technical assistance experts with us. Karen Cowell from Homebase will be speaking first, then Matt White from Housing Innovations will be going second. Today we're going to be talking about ESG new provider orientation. That is a giant topic. We cannot cover everything in 46 minutes, but we can cover many things. So we're going to have Matt and Karen going through a pretty high level conversation around what it means to be a new ESG provider. Once that's over, we'll have a chance to have you ask questions. You can raise your hand, I'll unmute you. You can unmute yourself. You can put them in the chat. We are definitely happy to have any conversations that make sense. And this is really for you to ask us and to converse with us. So hopefully that will work well. It is my pleasure to hand it off first to Karen Cowell, who's going to talk us through the beginning of our new provider orientation for ESG. Go ahead.
Great, thanks, Chris. As Chris mentioned, we're just going to do a real high level, give some high level information or review. Probably it's review for most of you. You can move ahead too, actually, Aaron. So we thought we would start with, if you're new to ESG, the first probably rule is there's a lot of rules you have to understand and follow. And so we wanted to just really hone in on some of the things that we see that folks sometimes struggle with, but we just wanted to review the components first. So, and I'm sure you're all well aware of these, but the eligible components for ESG-CV are rapid rehousing. Homeless prevention is eligible. It was only eligible under the first round. There is the eviction moratoria, which really impacts participant eligibility, and really, HCD is disallowing homeless prevention because there's other rental assistance resources in California through the ERAP program that can help folks, and so they wanted to avoid this duplication of benefits. You all know that emergency and temporary emergency shelter are components, street outreach. You can be funded for the homeless management information system, and then you can also get admin dollars. So really going into where we find spaces that people sometimes have challenges, we want to talk about eligible participants. And so I think it's really important you can go move on, Erin, to keep these in the forefront of your mind, especially if you're new. I mean, these are really basics, and it's important to start off on the right track, and really eligibility is where that starts. So who can we serve and how can we verify their eligibility or document it? So if you could move on to the next one. So this is a really valuable table to show which folks are eligible for which components. All of these categories are based on the homeless definition, which we can pop in the chat if people need a reference to that. The ESG virtual binder has a great series that walks you through this, but basically I'm going to go through them by components. So we're just a high level review. So when you're meeting someone and want to enter them into your program, that you have these in mind. I always tell folks to memorize the homeless definition when they're new to funding, because it really is the basis of what we're doing. So if you're working with folks in street outreach, the first category is of course category 1, which is, literally homeless folks who lack a fixed, regular, adequate nighttime residence. And of course, for street outreach, it's really only the folks whose primary residence is a public or private place where people aren't meant to live. So this could be on the street, it could be in their car, it could be in an abandoned building. You are eligible you can serve folks who fall under category 4, and category 4 is, of course, folks are fleeing domestic violence. And I mean, HUD's definition is pretty broad. So it's dating violence, sexual assault, stalking, any other dangerous life-threatening condition. It also includes human trafficking. So that's also important to keep in mind. So they can be fleeing, but they also still have to be on the street or living in some place not meant for human habitation. So they, and they're unwilling to go into the shelter, or they're unable to for some reason. Moving on to shelter, shelter is able to serve folks in all 4 categories. Homeless prevention, just quickly, even though most folks don't have this, it's really only categories 2 through 4 of the homeless definition. And the most important part of this one is the income requirement, that you have to be below 50% of your location's area median income. So you do have to check that when you're checking eligibility. There's also category 2 of the at-risk definition, which is kind of a whole other definition of at risk of homelessness. And then finally, with rapid rehousing, and we're back to category 4. So one of our most important populations are those who are literally experiencing homelessness. And these can be any of the 3 parts. They can be on the street, they can be in a shelter, or other temporary arrangement. This can also include being in a motel if someone's paying for it, like a charitable organization or other government source. This also includes folks who are leaving an institution, as long as that stay in either jail or mental health facility or whatever is less than 90 days. But before they entered, they met the definition of category 1, which means they were literally homeless before that. You can also, of course, serve folks who are fleeing in category 4 through rapid rehousing. But again, they also have to meet the definition in paragraph 1, which is that they were literally experiencing homelessness either in a shelter or on the street. So a lot of nuance there. So it's important to understand the categories. So eligibility is important, but some ways documentation and how we document that folks are experiencing homelessness is just as important. So your policies and how you're documenting eligibility have to have an order of preference. And so we'll have another slide with more detail, but sorry, go on to the next slide. My transitions aren't as good, sorry about that. So we have policies establishing order of preference. So third-party documentation is the best. This is the first one. The second level is working with intake workers through observation. That's the second preferred level. And then the third level is self-certification. So folks experiencing homelessness can self-certify that they are indeed homeless. It's always encouraged to use already available documentation, and that's under the third party and the highest standard. So this could be discharge paperwork, Lots of communities just really use HMIS service transactions and enrollments in HMIS to verify homelessness. So those are ways that you can document your participants' homeless status. You can go to the next one. So this is, sorry. So this is really the chart about the orders of priority for documentation. And you can see the arrow on the left shows the strength of that documentation, and third-party documentation is again the strongest. This is a great slide and chart to just have like at your intake workers desk, so they can always look at what the documentation is that they need. Again, second party is this written, and first party is the self-certification. You'll see that they do show some limitations. And then I think the thing I like to point out on this slide, or I like to say to people, is document, document, document. So one of the important things is that you're documenting your attempts, you're documenting your due diligence of trying to get third-party documentation. And when you can't get it, then you can go down to second-party documentation. The same thing with first-party documentation is as long as you're documenting your attempts to obtain third and second party, then that keeps you safe from someone coming and saying you didn't do your due diligence. Next slide. So sounds like a lot of that people have to prove they're homeless before they get services, but that's really not the intention of having this preferred order. Like we really do, the hierarchy is really there to help document, but we also know we have to have exceptions, especially when we're identifying folks through the homeless rule. So HUD recognizes there's lots of factors that may influence someone's ability to have that preferred documentation. So and we want people to have immediate access to shelters. We don't want to prevent people from coming in for a documentation issue. So if you're received, for example, like street outreach services as well as victim services, you may not have enough time to get that third-party documentation because the need is so immediate and so great. So when you're determining that eligibility for assistance, it's really important to address those immediate emergency needs. So the regs do recognize that, and they do not want that inability to obtain third-party documentation to prevent an individual or family from receiving emergency services, including street outreach services, or receiving services from a victim services provider. If you have folks who are fleeing or attempting to flee DV, that safety is your core and primary consideration in that situation. So the homeless definition final rule does make it clear that when the recipient agency is not the victim service provider, and only if the safety of the individual would not be jeopardized, then the program should attempt to get third-party referrals. So if someone comes and they say they're fleeing, but their safety isn't in danger, you should try to get that third-party documentation. Next slide. So whenever so the first step is, of course, evaluating the eligibility and the needs of the recipient of the services you're providing. So you do need to conduct an initial evaluation of every individual or family that's seeking assistance under ESG to determine their eligibility, as well as the amount and types of assistance that folks need. And it may be necessary, and really you're starting this intake process with understanding what folks need to regain and have stable permanent housing. So this evaluation has to be in compliance with any written standards for assistance that the recipient or subrecipient have established, and with the COC's centralized coordinated entry system. So your communities hopefully have written standards for this that you're able to follow. We also just wanted to note that when you're determining eligibility, be sure you're looking at income eligibility for homeless prevention if you're doing that. The last thing I wanted to note is there are special provisions for victim service providers. So if you are a victim service provider, there are some special notes and rules for you. If you go to the next one, please. So like I mentioned with homeless prevention, some components do have eligibility based on income. Ones that don't have any income criteria are street outreach, emergency shelter, and when you're initially evaluating someone for rapid rehousing entry. So those three components do not require any income or have any eligibility rules for entry. When you're administering rapid rehousing, you do have to keep track of how folks' income is increasing over time. So as you reevaluate folks on a regular basis, we want to make sure that their household income isn't exceeding that 30% of AMI. Again, with homeless prevention, at your initial evaluation, you want to make sure their income is less than 50% of AMI. And then as you reevaluate them every 6 months, you want to make sure that their income isn't exceeding that 50% of AMI. Those are all regulatory rules. And just as a note, we always want to be using annual income and not folks' adjusted income. The last few general requirements we just wanted to talk about so people have them in the forefront of their mind is that ESG requires you all to participate in HMIS regardless of the component. That even includes homeless prevention. You're required to participate in coordinated entry, and you're required to operate according to written standards. And one of the most important written standards is really that termination standard, and when you're just determining that someone you're terminating someone from your particular program or component. And we do have plenty of links for those things if you need them. So we're happy to put those in the chat. So I'm going to turn it over to Matt, who's going to help with some of the extra flexibilities y'all have under ESG-CV.
Thanks, Karen. On the next slide, it just sort of tees up that there are a number of unique flexibilities or waivers of requirements that are attached to ESG-CV, and then some flexibilities attached to the ESG annual. I'm going to quickly, as Karen said, some of these will likely be review, so I'll quickly go through them, but I do want to sort of tease where a flexibility or a waiver has certain applicability for the unique circumstances that might be what you're experiencing in the state of California, either a very high cost rental market, limited access to units, or if you're a brand new grantee and you just started up a project, there are some things that we just want to point out that provide some unique opportunities for you. You may not be able to take full advantage of them in this setting, but they are designed to afford you some flexibility in the way in which you operate your projects. So on the next slide, it's just a pretty high level overview of some of these flexibilities. Sponsor-based rental assistance. This is where the sponsor essentially enters into a legal agreement with the landlord or the property management company and then sublets those units that they manage to participants in ESG. And this is a great opportunity to make housing more accessible when you have a high cost rental market or when you have participants in your program who have really challenging backgrounds and just cannot compete in the open private rental market. And so you're able to reduce some of those barriers by locking in units as a sponsor and then essentially subletting those same units to your program participants. A couple of other things that you can do. You can provide renter's insurance if that's something that's going to entice landlords to be more willing to rent to your participants. That's something you can offer. You can offer laundry services. You can actually do welcome kits, buy furniture and household furnishings to get new households set up. There are some tricky sort of, caveats with how you manage that. And if you have questions about that, that's definitely something we can pursue either in the chat or in the live questions, some sort of pitfalls to avoid with that. Additional essential services that can be funded through the rehousing process. You can also provide personal protective equipment to either your staff or to program participants. can provide vaccine incentives. Sometimes a $50 gift card is a great incentive for a program participant to either get their final shot or get a booster, or otherwise engage in reducing the spread of COVID. Many communities have had to make some accommodation or adjustments to their coordinated entry process because they've got new screening elements, whether someone's been exposed and you want to be able to track that, or you've put them into a quarantine or an isolation unit, and you want to be able to track that. So if you have to make those changes to your HMIS or to your coordinated entry system, those are now eligible costs that you can charge to your ESG project. And then also, you're able to provide cell phone service. You can't provide the phone, but you can reimburse participants for the monthly charges associated with operating a cell phone. That's another kind of tricky caveat, is we want to be able to provide a phone because it makes access to clients much more accessible, but just some tricky elements around if you're purchasing a phone with your ESG-CV funds, you have to retain that phone as part of the program's equipment at the end of the client's enrollment. On the next slide, some additional flexibilities. You can set up hand washing stations. You can provide volunteer incentives if you need. Staffing is a real challenge, not just for the homelessness system, but across the whole economy. And more programs are exploring volunteers as a way to kind of shore up their staff capacity. And so there's some incentives that you can provide to them through ESG-CV. Obviously, there's going to be a lot of staff turnover, a lot of churn. So you want to invest in some training to do onboarding to make sure that you can get new staff up and running very quickly. Hazard pay, we're asking a lot of our staff who are having direct contact, either on the street or in crisis housing projects, direct contact with persons. And it just puts our staff at greater risk for contracting COVID. And recognizing that risk exists, you're able to increase pay. And this is a hazard pay incentive. And then also additional landlord incentives. There's a lot of financial incentives, either for just locking in a landlord for their commitment, deposit, signing bonuses, up to the equivalent of 3 months of rent. And hopefully that will improve your ability to acquire units for people who are experiencing homelessness to move into. So those are all some examples, and we can chat more about how to use each of them or some challenges with them. On the next slide, again, high-level additional program flexibilities. Previously, there were cost limitations placed on the amount of total grant activity that could be allocated to the emergency shelter component. That's no longer in place, so communities have much more flexibility to expand their emergency shelter footprint. There's no time limit for rental assistance, and this is a little bit confusing because the ESG annual prior to COVID or prior to ESG-CV had limits on the amount of time that you could provide rental assistance for. ESG-CV notice came out and established a more stringent time limit. So it was less period that you could provide rental assistance for. And then that changed midway through, and that was waived, or that was eliminated. So there's some confusion about, is it 2 years? Is it 1 year? Is it 3 years? There are no time limits for ESG-CV, and so that's an additional flexibility. If you happened to have used your ESG-CV funds to provide project-based rental assistance, and so as a subrecipient, you signed a lease with a landlord or with a property management company, and then you're subletting those units to eligible participants. Oftentimes, as participants exit the program, there's a little bit of turnover, and sometimes you have to either clean the units, or you have to, the documentation of finding a new participant and enrolling them and getting them moved in. And you can be reimbursed for up to 30 days during the time that particular unit is vacant. So that's some additional flexibility there. On the next slide, other program flexibilities. Subleases are now allowed. Previously, the participant had to be the primary leaseholder but you can allow your participants to be a sublet or a subleasee from the primary leaser. The housing still has to meet HQS or housing quality standards, but that's not as rigorous a standard as the habitability standards that were in place previously. So you still have to do that kind of checklist to make sure that the housing meets those minimum standards of HQS, not the more rigorous habitability standards. So somewhat more flexible there. And you can provide case management during the time that your participant is searching for housing. Used to be time limits on that, and they've been extended to a period of up to 2 months or 60 days. It's taking longer for people to find housing, and that just acknowledges that it could be up to a 2-month period to do that housing search and location process. On the next slide, still some additional program flexibilities. Indian tribes are now allowed as sub-award recipients. That was not initially part of the ESG-CV program, so that's a new element. Temporary emergency shelter was stood up as a component of ESG-CV. And now you can actually, and these temporary shelters in some instances were either motels or hotels, or that might have been an armory or some other kind of industrial use building that was retrofitted so that you could provide immediate crisis shelter. It was never intended to be a permanent shelter, but in some instances, those facilities have met a really critical need in communities, and the community wants to retain that use, that emergency shelter capacity. So you can now convert temporary emergency shelters into long-term or permanent emergency shelters. And we can talk more about that because there are some use restrictions and time periods you have to pay attention to. As Karen mentioned before, homeless prevention is an activity, although there are such deep resources in other areas through the ERA or Emergency Rental Assistance Program that HUD is sort of trying to diminish the focus on prevention, but you can provide prevention assistance, and it's eligible for participants up to 50% of AMI, which is a bit more flexible approach than in previous ESG funding. So addressing some challenges. I know that we have, looks like just about 20 minutes left, and I'm going to tee up what I think are very likely challenges for new projects, especially considering the environment and the kind of economy in California. But before I do that, on the next slide, I just want to reiterate elements of rapid rehousing requirements that absolutely have to be in place. These are sort of foundational elements of a rapid rehousing project. There has to be a lease. The lease is in the client's name, and it's between the client and the landlord, or your participant in your program and the landlord. So you can't provide housing assistance to someone who's in a doubled up situation to a host provider. The participant in your program has to be the leasee, the leaseor. Rent can be subsidized, but only to a point that it's reasonable according to the rate that is charged for other rents in the comparable area. So this is a little bit different than fair market rent, which is an established record. But rent reasonableness is still a standard that you have to meet. And we can talk a little bit more about some flexibilities for determining rent reasonableness and flexibilities about what those rates are. I mentioned before habitability inspections. You have to make sure that the unit is habitable, although it does not have to meet the HQS standard, which is a more rigorous standard. The lead-based paint restrictions are in place. Those are actually statutory, so they can't be more flexible or they can't be waived. You have to test for lead paint, and there are restrictions for participants who are under the age of 6 or buildings that are built before 78. And one other piece that's sometimes a bit confusing, there must be a rental assistance agreement between the landlord and the agency that's providing the assistance. So this is just communicating to the landlord the amount of subsidy that the landlord or the property management company is going to be getting from your agency or from your ESG subrecipient that's supporting the participant in the housing. The terms of that assistance and under what circumstances the amount of assistance might change or might be terminated. So those are elements of a standard rental assistance agreement. And then on the next couple of slides, I'm just going to quickly walk through some of the best practices that are in place around rapid rehousing. And we've kind of grouped these by category. So the first one is housing identification. What we found from projects that have great longevity and good success in other jurisdictions, to the extent that you're able to allow participants to identify their own housing, or at least their own community or the neighborhood where they want to live, it will create more chances of long-term housing stability, because the clients are likely choosing neighborhoods or properties or areas where they have other social supports, whether that's a school system or friends and family or church. So client choice of location is really a critical component of long-term housing success. So challenges with finding units, with building a sort of a reservoir of available rental units that you can use to support your participants in exiting shelter or exiting homelessness and into housing. And there are lots of flexibilities around how we recruit and retain those landlords. We can talk more about that, but that's a key best practice for your rapid rehousing, is having a robust and ongoing landlord recruitment, retention, or a unit acquisition component. Offering, sometimes staff have sort of a special affinity for working with landlords, developing those relationships, and then maintaining those good relationships. And what we found as a best practice is when you have staff who are particularly good at that, that becomes their sort of core activity, or dedicated staff to that particular function. If we move on to the next slide, I just wanted to chat about the move-in and rent assistance process. What we've seen in other jurisdictions, it's much easier as a rapid rehousing provider to just come up with a standard package of rent assistance. So in other words, every participant in your program gets full subsidy for 12 months. That's a standard package. It's not adjusted. You don't make any accommodations. It's just a flat kind of subsidy. But in reality, if you're able and establish policy for making standardized decisions around this, but if you're able to create a flexible package that builds skills or builds agency of the participant in the program to take over some portion of their rent, and then that increases over time, you're building good practice of making rent payments on time, so that the participant is able, at the point at which they're terminated from the program and they're no longer receiving rent assistance, they're able to maintain that unit for the long term. So that's a good practice of having a progressive assistance and a client determined, or a client centered focus on determining the amount of assistance that's flexible, so that you're avoiding that kind of, at the end of the project, the client is exited, and then all of a sudden they've not been used to paying rent and they have to pay 100% of the housing costs. It can be too much of a shock for some people, and it causes housing instability, and in some cases even a return to homelessness. So that's another sort of good practice we want to look at. And then the third component, housing focused case management. There are a focus on resolving the immediate crisis to get people into housing and support their success in housing. And there are a number of strategies that you can use that will ensure that transition from housing instability to being a leaseholder and maintaining their housing for the long term. There's some strategies that you can use that are housing first, recognizing that many people experiencing homelessness is a very traumatic, it causes a lot of distress. And so if you're focusing on a strengths-based approach where you're building their confidence, supporting their choice about where to live, the level of the extent to which to engage in case management, connecting them to other resources and services that are available throughout the community, and then focusing on how you're going to close the case. What are the conditions under which each participant is able to maintain their own housing, but yet have a sort of a risk plan? If they experience some event in the future that causes instability, to exit them with a plan for how they're going to manage that future housing instability, so that they reduce the chances of becoming homeless again. those are really high level, quick best practices. And now I just wanted to invite Chris to let me know if there are any chats or questions that have come up as Karen and I have gone through this, or if there are questions that Chris, that California recipients and subrecipients might be particularly interested in hearing about. And Karen and I will be happy to consider responses to those.
Thanks, Matt, and thank you, Karen. Aaron, go ahead and move to the next slide, please. All right, this is our discussion slide, so we've made it to the end of written materials. So please feel free to raise your hand, unmute yourself if you want to talk, or put something in the chat. We do have a few things that I'd like to kind of start with. So I will start with, let me find the right page, a peer question. So Robert from Humboldt has put in the chat, and I just want to re-amplify his question to see if anyone's been able to buy renter's insurance policies that cover damages caused by the tenant's negligence or intentional acts. Humboldt County is having a hard time finding an insurance company that sells that type of policy. So if you've had any success with that or any experience with that, feel free to put that in the chat, and hopefully that will help our friends in Humboldt County out. Okay.
I'll just say, Chris, it might be challenging to find an insurance company or someone who's going to underwrite a policy that covers where the damage is caused by the renter.
Yep.
But there is some flexibility with ESG-CV to provide additional damages that are caused by the participant or as a result of the participant being in the unit to the landlord or to the property management company. And those are eligible activities under the ESG-CV project. So that's another way around it if you can't find insurance to cover it.
Yeah. Thanks, Matt. Okay, coming to our first question, Matt, probably you, but also Karen, feel free to chime in. This from Marcella. I recall that furniture would need to be returned at the end of the project. We call that disposition, but can you elaborate on household items that are eligible? For example, welcome kits, cleaning supplies, towels, etc. So before you answer that question, Matt, because I'm going to give you a chance to cogitate on it, we're also going to put in the chat a link to a brand new resource about disposition and record keeping requirements for household furniture and household furnishings. I'll add that in there because I think I'm going to beat Aaron to it. That was released yesterday, which I think might answer some questions for Maricela. But again, Matt, we're talking about furniture disposition and then elaborating on household items eligibility. You want to give that a try?
So if I'm understanding the question correctly, I think you can provide material items that are necessary to set up a household, but those items purchased with ESG-CV funds are essentially borrowed by the participant during the period of program enrollment. So even though you might be using your ESG-CV funds to buy a dresser or to buy household items, those are only eligible to be used by the participant during the period of program enrollment. So they would have to then forfeit those items, and then you could either, transfer them to another household that's been enrolled, but the household cannot retain them after the period of program enrollment. There's one exception to that, though, which are mattresses. And I don't know the exact figure, but I think HUD has established sort of a cap. So you could buy a mattress, and I think for just hygiene reasons and bed bugs and things, it would not make sense to sort of, capture that mattress at the end of program enrollment and give it to someone else. So there is an allowance for the purchase of a mattress, and then the program participant can retain that mattress after they've exited the project.
Thank you, Matt. Karen, anything to add to that? I know that wasn't your section, but I know you also have some knowledge here, so I'll give you space.
No, I'm good. I think Matt gave a great response.
Yes. Okay. Just a clarification, Matt, when you were talking about the training flexibilities for the ESG-CV program, those trainings are specific to infectious disease, mitigating the spread of COVID-19 in particular, and not specific to like onboarding and that kind of stuff. That is not eligible, but we do have this flexibility now for that type of training. Do you want to say anything more about that?
No, yeah, I think that's exactly right. The flexibilities are specific to preventing, preparing for, or preventing the spread, preparing for, or responding to the coronavirus. That's right, Chris. Those are the flexibilities.
Great. Thanks, Matt. Karen, just a conversation that I wanted to shoot your way. You were talking about eligibility, and obviously eligibility is a big deal. So I don't want to get deep into it, but do know that our monitoring processes are starting, and eligibility is something that folks are going to need to be key on. Just wondered if you had any additional guidance or anything that you would mention around eligibility to make sure that that monitoring process is as smooth as possible.
I guess I'll go back to my mantra of document. I think like, I know that's particularly challenging often for shelter and street outreach, but I think for like rapid rehousing, I think that's one of the things that I always like leaned on, is making sure you print out the documentation out of HMIS that someone's homeless, that you document your attempt. So I think if you're trying to get second or first party, like you should document that you couldn't get third, or you couldn't get an intake worker to do it. So those are some of the things that I would recommend. Even with this shelter, I think that's important to document any attempts you do to verify homelessness. If, I think lots of shelters just fall back on observation by the intake worker because we see that. But I think like if there's other attempts you made, that you should certainly document those things. Maybe Matt has more to add on that one.
Nope, I think that's great.
Thanks, Karen. Thanks, Matt. Okay, what else did I have? Any questions? I don't see any questions in the chat. Anyone would like to raise their hand or unmute? Not seeing anyone step up. Just a few housekeeping things while folks think if they want to have any additional conversations here. We are planning a training series that happens is going to start happening this month into next month, all the way through September, October, in those time periods for new and non-traditional technical or non-traditional ESG-CV providers. So if you are an administrative entity or a provider that is new to ESG through ESG-CV, please reach out to us and let us know that you're interested in this type of training. You're going to see an announcement come out in the next week or two for this training session series. But it does kind of build upon this orientation that we're talking about today that allows us to have more deeper dive discussions and trainings into what a new provider would need to know. When we talk about non-traditional providers, if you recall back to the beginning of the pandemic, we were focusing a lot on trying to reach our communities of color. So maybe you partnered with someone that was new in your area. Those are what we're considering new and non-traditional, non-traditional being folks who maybe work more in the Latino, Latinx space or Black space, and they are also doing now ESG-CV. So if you have anyone like that, please make sure you let us know and refer us to that. I'll say this one more time at the end. I wanted to plug that in there. Matt, you mentioned tribal nations funding. We do have several tribal nations that have applied for ESG-CV funding, and we're working through that process. We have no news today, but just to kind of reiterate that, yes, we have flexibility for tribal nations, and we're actively working on that process here internally. Karen, you mentioned when we were talking about homelessness prevention, 50%. Matt clarified that typically that's 30% AMI instead of 50%. Just want to make sure that folks are aware that we're saying most of our stuff here is specific to ESG-CV, but we do have crosswalks between the two. Any guidance there that I missed that you might want to clarify on AMI? Nope. Great. Last question I'm seeing, and we can wrap up if this is it, about the eligibility of mattresses and if there is a an amount allowed for a mattress, I would go to the disposition documentation that we already put in the chat, but Aaron's answer is definitely accurate, reasonable costs, but you're going to want to look at those disposition requirements as well, located in this document that was published yesterday. And I think I just did that twice. A mattress would be a direct cost, Pamela. That is what that would be. So again, if you're going to do that, have those costs be reasonable. I think we know that mattresses can range from very low to very expensive. So we want that to be reasonable, just like we want our rent to be reasonable, all of that, so that we can serve as many folks as possible. Any additional questions? Oh, Matt, please fire.
I'll just say that question has come up in lots of jurisdictions, even outside of California, and HUD has responded in an AAQ. So if you are interested in getting more information about what are the limits on a mattress purchase, then you can just send an AAQ, send that question to HUD, and they have a standard response that I think can provide a little bit more clarity on what the cap is.
Thanks, Matt. Matt, anything you'd like to say before I finish up today? No.
It's no, other than it's, you know, yeoman's work to stand up a new project, and not just, as Chris said, ESG itself is really a regulation heavy program, and it can be very challenging to set up for new providers that don't have a long history. But then when you have ESG-CV layered on top of that, so there can be a lot of confusion around, well, what is the, you know, what's the flexibility, what's the waiver, what's required, what documentation do I need? So if you have if there's any ambiguity, or if you have questions about it, that is completely normal. And TA providers spend literally, you know, months and months and months trying to decipher all of these, so that direct grantees don't have to. So if you do have questions, you know, you have resources in ICF and HUD, and we'll certainly respond to them.
Thanks, Matt. Karen, any parting words?
No. Good luck to all the new providers, and remember to keep eligibility and documentation in your mind.
Excellent. Thanks, Karen. I'll just say it one more time. We are starting a training series. We should see an announcement in the next 1 or 2 weeks, entitled New and Non-Traditional TA, New and Non-Traditional Technical Assistance. And it is meant for, it's a series that's going to be meant for folks who are new to this work. So if you find yourself in that situation, or as an administrative entity know that you have a provider that would be benefit from this, look for that notice to come out in a couple of weeks. If you want to email me directly, you can use that and say, yes, I have this person interested. I'll get them on the list. But we should have that announcement ready here in the next week or two for you, and continue this part of the discussion of the new provider orientation in a much longer, much more detailed, much more hands-on approach than just a quick brown bag during an office hour. I want to thank Matt and Karen for presenting, and the ESG and ESG-CV teams for hosting and presenting the office hours in the beginning. We'll be back at it next week. Until then, hope you're having a great week. Be well.